Are you wondering about the coronavirus? Here are some updates about the coronavirus. According to the World Health Organization, the coronavirus are a large family of viruses that cause illness ranging from the common cold to a more severe diseases. A novel coronavirus, now called 2019 nCoV, is a new strain of coronavirus. It has not been previously identified in humans and not detected before the outbreak was reported in Wuhan, China. December 31, 2019, a clustering of pneumonia cases of unknown etiology was reported in Wuhan, Hubei province in China. The outbreak was later determined to be caused by 2019 nCoV.
The cases have been confirmed in all regions of China. The virus also reached in South Korea, Japan, Thailand, Italy, Macau, Russia, Sweden, Cambodia, Hong Kong, Malaysia, Nepal, Singapore, Sri Lanka, India, Taiwan, Vietnam, Philippines, Australia, US, Canada, Finland, France, Germany, and the United Arab Emirates, with most cases confirmed in people with history of travel to Wuhan. Health officials and experts all over the world are closely monitoring and investigating an outbreak of respiratory illness caused by a 2019 nCoV.
Additional cases are reported every day. As of February 5, the number of confirmed cases is over 24,500. The World Health Organization cites the symptoms of coronavirus infection are similar to common flu, such as shortness of breath, cough, runny nose, headache, sore throat, and fever. Severe cases can lead to pneumonia, severe acute respiratory syndrome, kidney failure, and even death. The possible source of the 2019 novel coronavirus is the Seafood City Market, which has been dosed since January 5 and sanitized. The virus can be transmitted among people. Many of the patients in the outbreak in Wuhan reportedly had some link to a large seafood and animal market, suggesting animal-to-person spread. However, a growing number of patients reportedly have not had exposure of animal market, indicating person-to-person spread in occurring.
The Chinese ophthalmologist Li Wenliang, who was among those who first raised the alert about the 2019 nCoV, died from the same disease he contracted while treating a patient.
The World Health Organization announced on February 11 a new name for the disease by the current novel coronavirus epidemic, coronavirus disease or COVID-19. As of 1 p.m. yesterday, there were 42,708 confirmed cases reported in China. And tragically, we have now surpassed 1,000 deaths. 1,017 people in China have lost their lives because of this virus. Most of the cases and most of the deaths are in Hubei province in Wuhan, China.
There are 393 cases in 24 countries outside China and 1 death.
There is currently no vaccine to the 2019 novel coronavirus infection. The best way is to prevent it from spreading. So what are the preventive measures that we must do? Here are some ways we have to maintain our proper hygiene and etiquette.
Frequently wash your hands with soap and running water or alcohol-based cleanser even if your hands are not visibly dirty. It is recommended to wash your hands after coughing or sneezing, before and after eating, after toilet use, before and after meal preparation, after handling animals, and if there is a visible dirt in your hands. Washing your hands with an alcohol-based hand rub or soap and running water kills the virus if it is on your hand.
Avoid touching your eyes, nose, and mouth with unwashed hands. Hand touch many surfaces which can be contaminated with virus. If you touch your eyes, nose, or mouth with your contaminated hands, you can transfer the virus from the surface.
Maintain social
distancing at least 1 meter between yourself and other people, particularly those who are coughing, sneezing, and have a fever. Because when someone is infected with a respiratory disease like 2019 nCoV, cough or sneeze, they project small droplets containing the viruses. If you are too close, you can breathe the virus.
Move away from people when you need to cough or to sneeze. Cover your nose and mouth with tissue or flexed elbow. Throw away the tissue properly. Covering your mouth and nose when coughing or sneezing prevent the spread of germs and viruses. If you sneeze or cough into your hands, you may contaminate objects or people you touch.
Avoid unprotected contact with farm or wild animals.
Ensure that food is well cooked.
Maintain a healthy lifestyle to build immunity. Eat nutritious foods, take enough rest, exercise regularly, and drink plenty of water.
Always remember, prevention is better than cure.